Virginia senators oppose Trump-backed budget cuts impacting vital services. Virginia senators slam Trump-backed budget cuts, warn of dire consequences. Charlottesville, Virginia. Virginia Senators Tim Kaine and Mark Warner are raising the alarm over what they deem harmful cuts to crucial programs and services statewide, resulting from actions by the Trump administration and Senate Republicans. The senators caution that these cuts could detrimentally impact schools, childcare, national security, and public broadcasting. This translates to $100,000 less for Virginia's NPR and public television stations, Senator Warner warned. Senator Kaine echoed this sentiment, stating, "In Virginia, passing a reconciliation bill that will cause 300,000 Virginians to lose their health insurance, coupled with the disastrous pausing of education funds, is catastrophic." Both senators have pledged to combat these cuts and are urging the House to block the legislation as it moves forward. But here's where it gets controversial. Critics argue that these budget cuts are necessary to rein in government spending and reduce the national debt. Yet, others counter that the cuts disproportionately affect vulnerable populations and jeopardize essential services. What do you think? Are these budget cuts a necessary measure, or do they go too far? Share your thoughts in the comments below. Copyright 2025 WVIR. All rights reserved. Fairfax Democrats slam GOP's Big Beautiful Bill, impacts on Virginians explored. A beautiful bill or a betrayal? Fairfax Democrats sound the alarm on GOP's sweeping legislation ***. Imagine a law that could leave nearly 12 million more Americans without health insurance, cripple Virginia's economy, and favor the wealthy at the expense of working-class families. Welcome to the reality of the GOP's One Big Beautiful Bill, a nearly 1,000-page budget reconciliation behemoth that has Fairfax County Democrats up in arms. The controversy unfolds. At a recent virtual roundtable, local lawmakers, including State Senator Saddam Salim, D37, Delegate Vivian Watts, D39, and Braddock District Supervisor James Walkinshaw, lambasted the bill, calling it a betrayal that will disproportionately hurt Virginians. Signed into law on July 4, this sweeping legislation promises to reduce tax revenues by over $4 trillion in the next decade, as estimated by the nonpartisan Congressional Budget Office. Where's the beauty? The bill's beauty is largely skin-deep. Beneath the surface lies a complex web of increased funding for U.S. immigration and customs enforcement, nearly $100 billion by 2029, and defense, $150 billion, offset by deep cuts to vital government programs. Over $1.2 trillion will be reallocated, primarily from Medicaid and SNAP funding, sparking widespread concern about the future of healthcare in Northern Virginia. A life and death issue. For many Americans, this isn't just about policy, it's a matter of life and death. Supervisor James Walkinshaw, currently campaigning to replace the late Representative Jerry Connolly in Congress, emphasized the bill's devastating impact. It increases red tape, implements arbitrary requirements, and makes it harder for Americans to access Medicaid and other crucial programs. The Medicaid conundrum. Key changes include requiring adults to work at least 80 hours per month to receive Medicaid or Affordable Care Act marketplace coverage. Additionally, states must re-evaluate the eligibility of all adults every 6 months, starting in 2027. Though a final analysis is pending, the Congressional Budget Office estimates that a similar Senate-passed version could increase the number of uninsured Americans by 11.8 million. A motive questioned. Walkinshaw posits that the GOP's primary motivation is clear: cutting taxes for the very wealthy and taking health care from working people. Fundamentally, that's what this bill does. Unnecessary provisions and unintended consequences. Delegate Vivian Watts highlighted the bill's misplaced priorities, such as a provision allowing tipped workers a $25,000 income tax deduction, which she argues solves a non-existent problem. Most tipped workers, including those in restaurants, already don't pay federal income taxes due to their low earnings. Virginia's unique concerns. Watts also noted Virginia's significant loss in tax revenue from immigrants, given the state's high deportation rates. ICE arrests in Virginia have surged by 350% this year, with most occurring in Northern Virginia and the Richmond area. These working immigrants are paying taxes, they have a social security number. Those taxes will disappear, Watts warned. The debate continues. Now it's your turn. Do you believe the One Big Beautiful Bill is a step in the right direction or a betrayal of the American people? Share your thoughts. Do such sweeping legislative changes prioritize the needs of all citizens, or do they favor a select few? We invite your comments below. Minnesota leaders slam GOP budget for gutting healthcare, education, and immigrant rights. This isn't just a budget debate, it's a fight over the soul of Minnesota's communities and the kind of country we want to live in. Local officials and advocates are raising the alarm over a sweeping Republican budget proposal, warning it would pull the rug out from under working families, students, immigrants, and the most vulnerable among us. But here's where it gets controversial. Defenders of the bill insist it's the prescription for economic renewal. So who's right, and what's really at stake? At a recent press event at the Sabbathani Community Center, a coalition of Minnesota leaders, activists, and community voices united to denounce what many are calling the harshest federal budget bill in recent memory. Critics have even gone so far as to label it the Big Ugly, pointing to deep cuts in Medicaid, food assistance, and education funding, while ramping up immigration enforcement and slashing taxes for the nation's richest. Congresswoman Ilhan Omar, who spearheaded the gathering, didn't mince words. She called the proposal immoral and warned that it threatens the well-being of ordinary working people. We're talking about 17 million Americans being forced off Medicaid and a massive $186 billion cut to food assistance through SNAP, Omar explained. For Minnesota's 5th District alone, that spells lost access to health care and basic nutrition for tens of thousands. And this is the part most people miss. The most severe cuts are delayed until 2027, an intentional move, Omar argued, to hide the impact from public scrutiny and avoid backlash in the immediate future. The message from local officials was equally urgent. Hennepin County Commissioner Irene Fernando underscored just how vital SNAP and Medicaid are for the region. She pointed out that, last year, $200 million in SNAP benefits helped feed 1 in 9 county residents. If this funding disappears, she warned, hunger and health inequities could spiral. The budget's threat to education also drew furious criticism. State Senator Omar Fateh, who leads the Senate's Higher Education Committee, cautioned that Pell Grants, the main source of federal aid for low-income college students, stand to be slashed by an average of $3,000. That means students from rural areas, communities of color, and low-income families might have to abandon their college dreams, he said. As a sobering example, Fateh cited the abrupt layoff of 60 nutrition educators from the University of Minnesota after SNAP funding dried up, a sign of even bigger ripple effects ahead. And for public schools? Representative Sidney Jordan made it clear, handing tax breaks to billionaires doesn't put food on the table for children or improve our classrooms. She argued that while state leaders have tried to soften the blow by tying education funding to inflation and expanding food programs, local measures simply can't replace the scale of federal support. The gap, she warned, will hit school districts hard. But immigration policy may be where debate gets most heated. Mariah O'Malley of Unidos MN didn't hold back, calling the expanded immigration enforcement plan fascist and a source of fear in immigrant communities. How can anyone feel safe, she asked, when ICE operates with a budget greater than the military budgets of 188 countries, and fewer checks on its power? O'Malley urged Minnesotans to stand up for due process and solidarity, insisting that this approach undermines community trust. Energy and climate advocates weighed in, too. Peter Woodgenius from the Sierra Club accused the bill of destroying clean energy investments and enabling polluters. It's legalizing corruption, he said, warning that Minnesota's advances in renewable energy could stagnate, while energy costs and job losses mount, especially in states that lack local investment. Healthcare advocates say the bill would cause immediate harm. Ruth Richardson, CEO of Planned Parenthood North Central States, highlighted that more than 27,000 patients in Minnesota instantly lost Medicaid support after the bill was signed. She was quick to note a common misconception: federal Medicaid funds, by law, cannot cover abortion services due to the Hyde Amendment. What's actually being defunded are cancer screenings, birth control, STI testing, and preventative care, she clarified. The result? Women and families already struggling to access affordable healthcare now face even more barriers, a point sure to stir debate, especially among those who misunderstand where the cuts fall. Despite these obstacles, Richardson affirmed that Planned Parenthood is determined to stay open, maintain its sliding scale fees, and help clients navigate their shrinking options. But with Title X funds frozen and patient demand rising, she warned the challenges will only grow. As the press conference wrapped up, the call was clear and direct: Minnesotans can't afford to sit this one out. The invitation was for everyone, whether you can give money, time, or simply raise your voice, to get involved. We might not have millions to pour into elections, Omar concluded, but we have community power. That's our greatest strength, and how we push back. Of course, supporters of the GOP-backed budget see things differently. House Speaker Mike Johnson argued, this is jet fuel for the economy, and all boats are going to rise. According to him, tax relief for the wealthy will spark economic growth and lift everyone. But here's a twist you might not expect: not even all Republicans agree. Representative Thomas Massie of Kentucky voted against the bill, warning that it will actually worsen deficits, drive up inflation, and hurt everyone over time. What do you think? Are these cuts necessary to restore fiscal health and ignite growth, or will they deepen inequality and hardship? Is slashing safety nets the path to prosperity, or just a new form of risk for millions? Drop your thoughts in the comments, let's get the conversation going.